Ischemic stroke, Alteplase versus aspirin. Ischemic stroke is the result of local thrombus formation or emboli occluding a cerebral artery. Thrombi are the result of carotid atherosclerosis and plaque rupture, while emboli result from the stasis of blood in the atria or ventricles, resulting in a clot. That clot can then dislodge and travel to the cerebral circulation. Thrombus or embolism result in arterial occlusion, decreasing cerebral blood flow and causing ischemia and ultimately infarction distal to the occlusion. Clinical presentation. Patients will present with unilateral weakness, inability to speak, aphasia, dysarthria, loss of vision, vertigo or diplopia, falling, and altered level of consciousness. Recognizing the signs and symptoms of a stroke and calling 911 are incredibly important. Every second counts in stroke recognition and medication administration. Alteplase, TPA, or tissue plasminogen activator. Mode of action. Alteplase acts directly or indirectly to convert plasminogen to plasmin, in turn cleaving fibrin, which lyses thrombi or emboli. It's important to note that clots become more resistant to lysis as they age, and therefore the administration of alteplase in a timely manner is critical. A complication associated with alteplase administration is as the clot dissolves, thrombi form and can result in local platelet aggregation and thrombus formation. Strategies to prevent this include administration of antiplatelet or antithrombotic drugs like aspirin or heparin. Efficacy. Alteplase is the standard of care in patients with ischemic stroke without hemorrhage. It is used in conjunction with thrombectomy. It needs to be initiated within 4.5 hours of symptom onset and is contraindicated in pregnancy, large wounds, brain tumor, head trauma, intracranial bleeding, or metastatic cancer. Safety with alteplase. Thrombotic agents affect unwanted thrombi as well as beneficial hemostatic plugs, making the greatest safety concern hemorrhage. Most of the contraindications for alteplase are related to just that, hemorrhage. The cost of Alteplase is $7,000 a vial, which is 100 milligrams. And that's just the cost of the medication. The cost of monitoring after the medication is also expensive, as the patient needs to be admitted to the ICU for at least 24 hours after the administration of TPA. Expected outcomes are the improvement in signs and symptoms of stroke, as evidenced by improvement in the NIHSS score from initial evaluation. Additionally, ongoing NIHSS monitoring takes place for possible hemorrhagic conversion. Another drug that's used in stroke is aspirin. This drug is significantly different than TPA, as it does not reverse the signs and symptoms of a stroke. It just decreases the incidence of recurrence. Mode of action. Aspirin inhibits thromboxane A2 synthesis by acetylation of a serine residue on the active site of COX-1, thereby irreversibly inactivating the enzyme. The balance of mediators favors the anti-aggregatory effects of prostacyclin, thereby preventing platelet aggregation. The effect of aspirin is rapid, and it results in suppression for the life of the platelet. Drug interactions. The higher the dose, the greater the drug-related toxicities, and these toxicities affect warfarin, phenytoin, and valproic acid. Basically, because aspirin competes for sites, making The therapeutic levels of warfarin, phenytoin, and valproic acid significantly higher in patients who are also on aspirin. NSAIDs inhibit COX-1 by transiently competing at the catalytic site, so aspirin should be taken at least 60 minutes before or 8 hours after NSAIDs, like ibuprofen. Efficacy. Complete inactivation of platelets occur with 75 milligrams of aspirin daily. The recommended dose is 50 to 325. Safety. Bleeding time is prolonged, resulting in complications like hemorrhage and GI bleeding, especially at higher doses. Toxicity can be fatal, especially in children at doses as low as 10 grams. Cost. Aspirin is available over the counter, and for an 81 milligram tablet, it can be between 2 and 6 cents, depending on the brand name. Expected outcomes. With aspirin, there is a significant risk reduction for repeat events, especially when combined with clopidogrel. Here are the references I used for my presentation today.